everybody. My name is Jocelyn Medina, and today I'm going to be talking about the critical role of vitamin D in rural and Hispanic populations. On June 15th of 2023, an EF3 tornado hit the north side of my hometown, taking with it half the town, dozens of homes, and claiming 3 lives. Unfortunately, this side of town happened to home 70% of the Hispanic population, most of which did not have health insurance. Imagine my surprise when upon arriving and offering rides to the hospital, I was refused, bleeding, walking away, and denying help. It was only after this incident that I realized that this is a common occurrence even in non-disaster stricken towns. People who live in rural areas often tend to be older and sicker compared to people who live in urban areas in the United States. With all of this being said, we want to know why. This is most likely due to higher rates of poverty, less access to health care, and more individuals have no health insurance. How can we fix this problem? Well, before we go and try and save the world first, let's try to start with something small. Emerging research highlights the significance of vitamin D in rural populations, specifically because this is where there tends to be no health insurance, and this is where a lot of Hispanic individuals tend to be. Our study of rural West Texans found that there is a disproportionate amount of vitamin D deficiency linked to rural populations, no health insurance, and low self-reported health. So starting right here, we're going to focus for this talk on 3 main things. We're going to focus on general health rating versus ethnicity right here. Okay. We're going to focus on vitamin D levels versus ethnicity and vitamin D versus insurance status. So here you can see that Hispanics tended to rate themselves, or were less likely to rate themselves with excellent and very good health compared to non-Hispanics, and this was a significant difference. When it comes to vitamin D levels, Hispanics were more likely to have lower vitamin D levels compared to non-Hispanics. And lastly, uninsured individuals were more likely to have lower vitamin D levels compared to insured individuals. With vitamin D being linked to diseases such as diabetes, depression, and Alzheimer's disease, this is definitely something we should be looking into. As a Hispanic from a rural town, and as an aspiring physician, this hits really close to home, quite literally. It is my goal to continue to look into addressing vitamin D deficiency and health insurance status to improve health disparities. With research such as this, it is important to look into this further and by implementing new interventions. This will help us globally to reduce global diseases, especially in vulnerable populations. Thank you.